Oral diseases affect most of us. The cost of treatment often exceeds that of other diseases such as cancer or dementia. The pain and discomfort they generate affect us in our daily life, at school or at work. But we don't always know how to avoid them, and a coherent strategy is not in place in Europe to facilitate their prevention. On the eve of World Oral Health Day, a summit was held to raise awareness of this problem.
An enormous progress has already been achieved in the wealthiest parts of Europe, but this program hides unacceptable inequalities between and within countries. Our health policy needs to be on the agenda of the European Union before 2015.
Most of the population of the European Union have some oral disease and some have quite severe oral disease. It's also very expensive. In this year it's estimated that 79 billion euros will be spent on oral health care.
In front of the European Parliament in Brussels, the Platform for Better Oral Health in Europe shared information and advice to prevent dental caries and gum disease. Oral hygiene products were handed out to more than 2,000 people to help them take care of their teeth.
And today there was a big report in Europe about the state of oral health.
Yes, I heard about it.
Okay, great.
During the day, more than 50 people had their teeth checked in a dental bus outside the Parliament. In partnership with the platform, the checkups were performed by trained dentists from the Belgian Dental Association.
VVT-glimlachen.be is running a local prevention program in schools and other facilities and this for the past 3 years.
Toothbrushes, tubes of toothpaste, and sugar-free chewing gum were provided by the corporate partners of the platform to inform participants about the simple tools that they can use to prevent oral diseases.
Wrigley is participating in the Platform for Better Oral Health in Europe because it's something we've always believed in. We know good oral hygiene is important to one's general overall health, and we know oral disease is something that's preventable. If you have a good diet and you employ healthy habits, you can guarantee yourself good oral hygiene for the rest of your life.
Prevention is more important than ever. We as GSK, we're proud to be associated with this platform and can help to be part of the solution.
Awareness-raising activities such as this are key to preventing oral diseases and informing people about how to best take care of their mouth. But they need to be coordinated and backed by strong research and policies. At the occasion of World Oral Health Day, experts and decision-makers gathered from across Europe to pave the way towards a future European oral health policy. Over the course of the conference, hosted by Ms. Kadenbach and Mr. Bushoi, members of the European Parliament, and in cooperation with the platform and under the patronage of the Cyprus presidency of the EU, concrete priorities for action were defined. Key findings of the platform's recently launched report on the State of Oral Health in Europe 2012 were also presented. They described the prevalence and cost of oral health, analyzed national and local prevention programs in European countries, and summarized key political priorities to tackle oral diseases. 5 priorities for action emerged from the discussion. The first, to develop a coherent European strategy with commitments to quantifiable targets by 2020.
We do not need more surveys. What we need is action.
The second priority, to improve the prevention of oral diseases by integrating the oral health dimension into all healthcare and social policies.
What we need to do is to make sure that all the policies we have are connected, are implemented, and that oral health is seen as an integral part of those policies, not as something extra or something additional. It is an integral and vital part.
The third priority, to develop common methods to collect data from across Europe to further the knowledge base and to bridge the research gap in oral health promotion. The fourth priority, to develop partnerships and cross-sectoral approaches with health and social care professions to tackle increasing oral health inequalities and guarantee availability and access to high-quality, affordable oral health care.
We need to start thinking differently about how we manage oral disease and promote oral health. And we're going to need to work much more closely with our colleagues in medicine. And we need to think about interventions that operate at the level of communities rather than individuals.
And most importantly, the fifth priority, to improve prevention policies and the level of knowledge of healthy habits and good oral hygiene practices of the public, and to encourage best practice sharing across countries.
In this moment, there are a lot of good initiatives in all EU member states, initiatives promoted by representatives of industry, by NGOs, by local authorities, by medical field. But not always all these initiatives are backed with real research, and not always they are promoting the most effective way in order to achieve the best results. That's why I believe that European Union institutions can coordinate a little bit these efforts, can establish some benchmark, and in the same time can harmonize all these efforts in order to obtain the best results.
Conference participants from across Europe also took the opportunity to exchange ideas and create new partnerships for concrete actions in countries and regions. The summit is a first big step towards preventing oral diseases. But the clock is ticking. Oral health inequalities are growing whilst healthcare budgets are shrinking, and reimbursement of treatment is imposing an ever greater burden. We are faced with a major health challenge.
Not everything can be done by the European Union, but a lot can be started. What today has shown to me that we are ready, the decision makers, the experts, the professionals, the industry, to take a step further and define concrete lines of actions to address the issue.
To provide for better oral health tomorrow, a coherent strategy for Europe needs to be put in place today, with concrete, measurable outcomes by 2020 and a radical shift in mindsets.